This is Rocky Snyder. At the tone, leave your name and message and I'll get back to you.
These are our newly arrived surgeons, Doctors Trowbridge and Greenbaum. Doctor? 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 Doctor?
Doctor?
Doctor?
Doctor?
Doctor?
Welcome to another episode of the Rockfit Files. I'm Rocky Snyder. With me is Vivian Houng, or Dr. Houng, because in this world of anatomy and motion, it's very rare to actually speak to somebody in the medical field, like the traditional Western medical world. And well, Dr. Houng is a medical doctor. She resides in Norman, Oklahoma, at the campus of the University of Oklahoma. And we'll just bring her on first with an apology, because Doc, I gotta confess, I was in Norman, Oklahoma a little over a year ago, and I didn't call you, and I should have, and I'm banging my head against the wall that I didn't. I was presenting at the university at a conference there, and I think it was the beginning of December of 2019, before COVID, of course, and it wasn't until I was getting back on the plane that I realized, wait a minute, Vivian's in Norman. So welcome to the show, and I'm sorry.
Thank you very much. I'm excited to be on, and not to worry, next time.
Yeah. Now, one thing about Norman, is there a hill anywhere nearby? Do you have any change of elevation, first of all?
The biggest hills are when they're doing construction and building overpasses. Then there is some elevation. The overpasses are elevation. The kids slide on the sled on the overpasses.
Well, that's comforting, because that was the only incline I could find to do some training while I was there. So if you saw anybody running up and down the embankments of the on ramps, then well, that was me, and I'm probably hidden under the overpass. But it's a beautiful campus, University of Oklahoma. Incredible football stadium, by the way. It just shines bright, and yeah, just beautiful. So let's just cut to the chase. How is it that a medical doctor is learning about human movement? I know that's a weird question, but there you have it.
Well, I mean, a medical doctor should understand human movement, right? But so the way that I found anatomy in motion is a medical school classmate of mine, actually, in 2015. So she and I both really like functional medicine, which is, I'm trained with an allopathic MD. Functional medicine wasn't really a thing back when I got my training and degree. So she said, hey, there's the BBC Doctor in the House program, and this guy does house calls and he stays with patients. So we were both watching this show. And then when it came to it, I was going to be doing traveling in England. And she said, remember Gary Ward? He's in London. You should look him up. So this was 2016. And of course, it was not really an option to get an appointment with Gary. I couldn't really find any means to do that. So I looked up other AIM practitioners in the Oxford area and found Mark Thulis, who's in Wallingford, who actually, I was having some hip and foot problems when I was trying to get back to running. And I was told what almost everybody is told: you're getting older, there's wear and tear, you just can't run anymore. And but when I had seen the episode with Gary Ward, it just, something about it was like, I have to see this looks amazing, it looks right. And had a couple of sessions, which right away it just makes sense. And then after that, I got Gary's book, and I was looking for courses, which there were not a lot. I mean, I was kind of surprised. I thought, like, oh, I'll wait till he comes around nearby in the US. And then, oh, there's just one place once a year. I could go to Ireland or Australia. So anyways, I ended up taking the course. So how did MD, okay, so functional medicine, right? That is about getting to the actual underlying cause, right, of issues. It's about helping the body to do its own healing. It's about trusting that the body's going to heal itself if you remove the injury, if you remove the toxins, and you provide the support the supportive environment or the nutrients. And anatomy in motion is basically movement medicine, right? You're identifying what is causing the body repetitive injury. So I've always had an interest. I've always had a frustration with my background in training, and I've always brought other things to my medical practice. And so anatomy in motion, to my mind, fits very well with that approach for the musculoskeletal, for the physical body. So I don't have a specific training in sports medicine, orthopedics. We work a lot with that, of course, at the university. We have sports fellows and a lot of athletes that come by. But
Yeah, it's really interesting. When I found out the limited amount of classroom hours in medical school that students take in regards to biomechanics, human movements, integrative action, or it was just astounding. It was measured in hours or weeks, or between hours, days, and weeks. And we're talking, how many years were you in medical school?
it's 4 years of medical school, 3 years of residency training, and then if you do an additional sports medicine fellowship, it's another year. But um, definitely the 6-day immersion course. I mean, I recognized the names and I understood the anatomy, but it was complete content overload. I mean, not just by the end of the 6 days, but like partway through the first day. I mean, it's a lot to grasp. But it feels like I wished I had had this from the beginning, and it would be great if this was actually an integrated part of medical education curriculum.
Yeah, rather than just simply the traditional approach, which is uh, immobilize or rest and prescription medication to reduce inflammation. So,
Yeah. I mean, immobilize and rest and lose further function. I mean, and just accept it.
yeah, accept it. And it's quite interesting you bring up the aging factor that we always hear. Well, you're getting older. And I often will just stop people in their tracks and say, no, you're just getting less active. As you get older, there is this other thing that's occurring kind of off in the shadows. And simultaneously, as you age, the typical person is going to get less and less active. So their body's going to break down because of that, not because of the aging process. Because if it was the aging process, I wouldn't have a client that's in her 80s doing marathons, right? So, but it's something that's promoted, just like the aesthetics and fitness. I mean, I imagine you must get completely frustrated within your field and your peers, your colleagues, when you try and discuss these things, and there's just a complete kind of deer in the headlights look as to what the heck are you talking about. Just give them this script and send them on their way. For me, it's in the fitness industry. There's often times where we're just seeing trainers doing a whole bunch of superficial actions to isolate an area for aesthetic purposes. And it's just this, I guess the whole thing is all about superficial approaches and not getting to the deeper roots. You must feel that within your colleagues. I mean, anytime you have a gathering with other medical doctors, and have you had discussions like this?
I've only had a couple of discussions with like a couple of colleagues in the clinic. I've talked to many, so I have many friends that practice elsewhere who actually have been my early guinea pigs when I was like practicing. Very happy, very interested. And one of them, she's actually really would like to take a course, and then COVID hit because what happens is like you are yourself the aim guinea pig, and then you feel it and you recognize this is the thing, and it's exciting and you want to do more, learn more. um, but if you don't get to that point, well, okay, I mean, if we back it up, I would say yes, a lot of the approaches is, I feel like standard medicine, physical therapy, there's kind of cookbook, recipe, and brute force as far as like, oh, there's this issue. We're going to just put like, this many repetitions. We're going to just leave the walking boot on for this long. And again, this kind of goes back to some root frustration I have with the system, but it's a really big paradigm shift, and it's really mental effort and time effort. It's very time consuming to be willing to say, hey, could the way that I've been trained, I'm familiar with, I know eventually for some people it gets some results, so it must be okay. And if essentially it feels like I'm not causing harm and this is what everybody else is doing, it's a big paradigm shift to say, let's look at this completely differently. And so it just feels like there's not enough maybe time or bandwidth for people to be willing to give it a try.
Well, it
So
seems what it comes down to is time, because then you look at, well, bring insurance into the
oh,
equation,
oh,
and
don't.
they're limiting your time as as little as you can to be as effective as you can in 15 minutes or less, right? Or whatever the time frame is. So how can you really explore the issues that people are really coming in with if your only amount of time is going to be measured in just a few minutes?
Yeah, it's very, very difficult. So, I mean, I understand why there's resistance, and in fact, so the one friend of mine who she does want to embrace it, but the few other friends who they like it, they believe in it, but there's not going to be any effort to like actually really incorporate it into their practice. So,
Well, that leads me into that question about incorporating it into your own practice. So here you are on a university setting, which is renowned for research. So you are kind of in a wonderful, potentially wonderful place that could show efficacies to this approach and whatnot. But you're in a clinic that's an outpatient basis right there on campus. Tell us the average kind of students or faculty that come and see you, what are the primary complaints? Is it orthopedic?
actually not. Actually, if not, we see a fair amount of it. We see a fair amount of like kind of training, overuse, and then just injury. But we also see lots of like infections, respiratory, genitourinary, kind of reproductive, the young college population care. But also too, I have a lot of like with the faculty and the staff, diabetes, cardiovascular, so chronic, and then also just say like desk jockey type of like musculoskeletal ailments. But I mean, we're family practice. We see everything, So I will see like infants for their new well child visits, and I have some 80-plus-year-old retired emeritus faculty. One guy, he's an 80-some-year-old tennis player. He's super frustrated because aging has slowed his game down. He can only finish a doubles match. He can't play singles anymore. So I tell him, I want to like, be in as good a shape as you when I'm 80 something. So
Now, how do you take the concepts, philosophies, or approaches that you've taken away from the immersion course and incorporate it in, even if it's just one little tidbit at a time, or has it affected your practice at all? I guess that's really what we.
I've I've definitely incorporated, and like strangely COVID has helped a bit. So, for our visits are not all 15 minutes. We can ask for extra time. And typically it's for, so if there's multiple systems, if they have like more than, if they come in and say, so diabetes, blood pressure, plus, stomach upset. So um the way that I do this is, so people don't really know what it is to ask for it, but they may come in and they may come in saying like, my knee's been bugging me for whatever time, or more commonly is they're in for the physical or the diabetes, something, something, something. And yeah, it's been hard for me to get walking, because I have this heel pain that I've been seeing, the podiatrist, and I have like this like orthotic and da 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 da. Da. And so I will say, hey, it's probably related to your alignment. And there's this like approach that we can use. Like there's standard physical therapy, or I see you're working with like the your podiatrist. But I say we could try looking at your alignment. And I don't know if it's because I'm on a university campus, but many people are pretty curious. They're interested in looking at that part of like, I said, maybe we can get to the underlying cause. And it's easier to, if they've seen me, they know me, they kind of know my approaches, like let's kind of get to the underlying source of what's happening for you, instead of I'm just going to give you a prescription for something, or refer you to somebody else. Anyways, so I tell them to come back, and I say, when you make your appointment, make sure you tell them that it's your leg, your ankle, your foot, and your neck. I'll say like, does your hip bother you? What about your shoulder? And so I can I can find out that there is generally much more of a history that warrants the extra time for it. And then also, if I can, I try to squeeze in, I say, throw off your socks and your shoes. I grab my iPad and I go ahead and grab at least like a walking and like the turning from side to side videos before they leave. And so I have something to kind of study and prep for before my next visit, because I know I've got to be super, super efficient squeezing in what we're going to do. And I have a little handout, you need to come back dressed to move and get barefoot. And so this is how I've kind of cobbled together in my clinic. I mean, it's still really not ideal. I actually have begun practice outside because it lets me not have to worry about insurance. And there's a really lovely yoga studio space that has an extra room that I've been able to like kind of use. And I'm trying to see clients kind of separately, more like I think how probably most AIM practitioners, do it, like kind of by the intake session and the follow-up session. But for how I integrate it into the clinic, that's that's my jerry-rigged method of squeezing it in, shoehorning.
Honestly, that's fantastic. I don't think I've ever been to a doctor's appointment where they say, okay, be prepared to come in and move. And by the way, take your shoes off. Usually it's, drop your drawers or something like that, or something, but never. So, what is that like for the response of the patient? Like because most people are just going, I'm going to the doctor and I'm going to sit there and talk. They're going to take my temperature, my blood pressure, give me a prescription, and I'm on my way. So when you tell them, hey, come in next time prepared to move and take your shoes off,
Yeah.
what do they say to that? Do they have questions?
Sometimes, not very often. They're typically pretty busy people too. But I give them my handout and I give them my card that links to my website. So I say, take a look at this method, see what it offers, and then I'd say 2/3 of people like actually come back for they want it, they want to do it, and they come back and they're actually excited. They're actually often quite curious and interested and excited. Sometimes people will do a session and then so I do the whole, these are the moves I want you to practice, I want you to come back for follow-up. And I'd say at that point it's maybe like a 50-50 rate of who actually comes back. I've had several people that have done maybe 4 or 5 follow-ups. I've had more that maybe did 2 or 3, and then the other portion of people who did it kind of the one time. And it's a huge paradigm shift.
It
So
is.
yeah. Oh, or you always have the ones, I'm sure you hear this all the time. It's like, oh, this is interesting. Do you think if I like do my yoga practice like this now instead, that this will like I can do this? And so I was like, it's really not the same. So they're trying to like fit it into like what they already know, what they already do. But it's really exciting. They're the ones that realize, hey, this is something different. This feels different, and they want to keep doing the anatomy and motion movements.
Well,
So
I have to admit, when I was there a little over a year ago on campus, it was, I think there was probably about 80 to 100 participants in it was the National Strength Conditioning Association's Oklahoma State Clinic right there on campus. And yeah, there must have been 80 to 100 participants, and they were all engaged. We were basically checking in with foot pressure and then getting a sense that, well, if their foot pressure is translating over here or migrating here, how they manage their mass is going to cause maybe these tissues to shorten and not be so excited. So let's roll those out with a foam roller and then check back in with your foot pressure. And of course, there was some change that occurred for most people, but it inspired quite a few people to look a little bit deeper. And many of those are not only the students there, but some of the faculty, or at least the coaches and the trainers. So this leads me to the next question. Do the sports med and the athletic department, do they know who you are? Do they know that you're doing anatomy and motion? No?
no, no, no.
What do you just kind of keep it secret, like you're I would say Clark Kent, and you only put on your cape when you leave the campus, or what? What are we talking?
It's interesting because so since we have sports med people in the clinic, I kind of see like the leftovers. So I see some of the maybe the well, I see for sure the recreational and maybe a couple of the club sports athletes or the people who couldn't fit in on the sports med schedule. So I'm really not in that loop. I'm not one of the team docs, so I don't go on the sideline, and so I'm not really privy to that. It's I mean, sports are big, big,
Big,
big.
huge.
Huge, huge. And as far as like the research, I mean, we have a very, very a top health and exercise physiology department here. Maybe like my energy right now is like I'm on the learning curve for this method, and I'm every day, every client, I learn something really important about how to apply it, how to be efficient, how to like communicate it in a way that's like maximally efficient. And so I just I haven't felt ready yet to like kind of present it, even though I mean, I am absolutely convinced.
So normally around university settings, you're going to get a higher level of education, obviously, and with that, a higher level of intellect and insight and more progressive-minded individuals. Uh, so with the patients that come in, it sounds like you have yourself already kind of warm leads, so to speak, in terms of going against the traditional approach of here's your prescription, rest, ice, and stay off of it, so to speak. Do a lot of people come in asking for a different approach, or just saying, "Oh, that's reassuring. I'm really glad that you're dealing with this, and I had never thought of how that is connected." Or what's your experience with the patients that come in? Are they fairly open to this, or do they say, you know what, I'm not going to do that. Just give me a prescription. I'm just going to take some ibuprofen and go on my way.
Well, I mean, people always want to know that this is not something scary and bad. That's baseline, what you've got to fit in.
Good point.
Um, and sometimes they'll come back a second time asking again, are you sure? um, and because when I'm in the clinic, I'm trying to I always fit it in with like, this is how you have to modify your activity, and these are what you can do, anti-inflammatory. I mean, I also include that as standard, and then it's in addition, these are the things you can be doing to help heal more quickly and expediently. Do I have um I mean, there's I'm I think I having I think I already have a sense of who's going to be receptive or interested. And when I kind of ask them, I'm already sorting that out. So by the time people come to me ready to take their shoes off and get barefoot, those are already the ones who have bought into it enough that they're not just, I mean, in other words, it would have been before I had them come back for that appointment. The ones who like, no, I just want, you know, can I get a steroid prescription? Or like, I already got my x-ray. So I
Gotcha.
mean, it's the same as if I'm going to do smoking counseling or nutrition counseling. I've gotten much better than when I was young at finding out efficient use of my time, because there's no point in going down the whole this is what's anti-inflammatory, do you want to quit smoking? You need to be able to like tell where people are and their interest in approaching things a certain way. Otherwise, they're listening to you and they're like, la 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 la, whenever is she going to be done talking about, and I'm not making good use of my time.
So when it comes to getting off campus, you mentioned that there's a yoga studio nearby where you're seeing clients, not so much patients, but you're seeing people. I'm curious as to the different types of assessment tools that you're currently using. You had mentioned videotaping their feet as they rotate left and right to see pronation, supination mechanics, sort of, and then watching them walk barefoot and doing a little bit of videotaping. Are there other approaches or methods that you're using to assess?
Well, I mean, when I'm off campus, I can take a lot more pictures, and do a lot more positions because I have the time to do it. And then um, I don't have a force plate. I don't always think about doing like the poor man. I think maybe because I've just kind of honed in on relying on like the video, I pretty much start getting into it and testing to see what they can or can't do. I mean, the posture assessment, right? Like the symmetry, how comfortably, how easily they can. I mean, for what feels like catches my eye is like um, how fluid or not fluid, or how evenly distributed their movement is. And so sometimes it's really more like they're just really still. They're really locked in. I mean, many people, of course, the thoracic segment, right? Because they're sitting at the desk, rounded shoulder. I mean, the funny thing is if you look at my musculoskeletal notes before anatomy and motion, I always, I mean, I've had an interest in manual medicine and low back. My husband happens to have chronic low back pain, so I have forever charted rounded shoulder, forward head, tucked pelvis, decreased, it's something I've always paid attention to. And the funny thing is after I had the training, I have had friends from college that I literally, it's like the moment I was waiting for at the last reunion. These are people who I always knew there was something about the way they moved and stood. And I finally had a chance. I said, okay, your knee, and oh yeah, I've had to stop running because it's been bothering me. Is that I knew it would. Ever since like college, I knew there was something about the way your feet were. So I think that part about me personally has not changed. Now I just have an excuse for like looking at and observing um those things about how people move or stand, and then now I have something to do to try to apply towards that or test it and to see is that really actually the case for that person's body. So I typically will actually try moving them and hearing what they're telling me about how it feels for them, whether it's something, because I have a lot of people who they're injured, right? And so I've had to learn very much to do a lot of modification and to like help gain their trust that we're going to stay within what's comfortable and that they're going to direct the movement. And so the modifications, and then I commonly, especially if they're having a really hard time compared to the other side, that's very instructive. And then depending on what's going on, I do a lot of circling around. So I'll say, okay, gently give me a couple more repetitions. And so I will confirm with my hands about like how the scapula, when I ask them to do the crucifix, how much movement, what's the texture of the tissue. When I ask them to give me some more rotation in the pelvis, kind of feeling for that. So I rely a lot, yes, visually. It's how I kind of save time with the videos and such. But then when I have them there, then it's as much what they're feeling, how it looks to me, what I'm, I did that. I'm not really sure how else
Yeah,
to
no,
convey.
that's fabulous. No, honestly, that's great. I'm often just intrigued by history, whether it's personal, world, local, whatever. And I'm intrigued by your history because of the fact that I only can think of maybe one or two other people that are medical doctors that have been through the course. Gary and Chris could probably tell me there's a few more, but only a couple stand out. And you being one of them, I'm curious as to what your background was like that brought you to medicine, but at the same time gave you this more comprehensive view of like you mentioned, taking notes prior to the course. You were always kind of intrigued by body position when
Yeah.
that wasn't in the curriculum at medical school. So what was your background? Did you athletics, dance? What did you do leading up to school?
No, totally like not athletic. I'm a biology major. I like biology. I want to know how things work. I like to know how things work. I am an efficiency hound. I rail at the civil the road planning. It's not efficient. The way they've organized this line at the airport, if they would have people like check their bags, I want things to work well. I want things to be efficient. Allopathic, the MD medicine, it's too late. It's not efficient to like do the heart catheterization. We need, nationwide policies that like fruits and vegetables are cheapest and easiest for people to eat, and that communities are built so that walking is the easiest thing to do, not getting into a car. So at my heart, kind of personality wise, I'm an efficiency person, and I want, um, I want people to feel well. And so when they are moving in a way or standing in a way, and of course, I'm seeing people day in, day out. I have neck pain, I have back pain. It's like, well, you need to get out of this position if you're gonna. I can give you muscle relaxers, but you are still gonna have like back and neck pain, day in and day out until we get to the underlying cause of your issue. So, very late as an adult, being physically well is something that I needed to learn. So I took up jogging, and I really enjoyed that. And so when I got older and I was having these niggling aches and pains, and then uh, recently, I've been like looking into doing some judo and jujitsu, which has been great fun as well too. And I've dabbled in I don't know very much about yoga, just enough to know some of the basic poses, but I haven't done any team sports or competitive. So I think it's really more my interest, my personal interest and approach to how
Uh,
things work.
I no, honestly, I hear it from a completely logical perspective. You know, all the pursuits you did were for a pursuit of knowledge or logic. And but the interesting thing that hits home to me is how things work. And I think that kind of resonates through the majority of people that are pursuing such information is we're just curious as to how this is working. And what we've been told doesn't really line up with what we're seeing. So what is happening here? If your husband with his lower back issues, it wasn't just one day he woke up and the lower back said, "Hey, I've got a great idea. Let's just start messing with his life," for no apparent reason, right? There's always kind of that history of okay, if this was happening, then this is happening, and then you find out how this is all working, and then the curtain is pulled away from your eyes, and you're like, now I can understand a little bit more about movement. So where do you see like the clinic right now in your work at the university? Do you have others within your department that, well, you said there's a few of your colleagues that are curious, but have any of them kind of had sessions with you? Do you see them kind of being curious about it?
Well, there's one of the women there. She definitely was curious. She knew I'd gone to the conference, the immersion, and when I came back, she's like, "Okay, do me." And so she thought it was very interesting, and to time, she wasn't going to be able to incorporate it. But the funny thing was, like, recently she actually said, like, oh, she came over, she's like, "I'm having this horrible neck crick, I don't know what happened." She is younger than I am. And then I said, like, "Oh, well, okay, let me see." And so I just kind of had her do some of like the cogs and the such, and I kind of cued her like really gently, and she's like, "Oh, that's feeling better already, that's feeling." And then later in the day when I checked in with her, she's like, "Yeah, I've been like gently trying those movements you suggested, and it's feeling much better." So if you want to say buys in, right? She like buys into it, but hasn't, she's not in a place to incorporate it herself. There's another colleague who he's waiting to have knee surgery. He's had trouble on and off for a long time. I've offered many times. I said, "I'm available. We could look at that." He's like, "Yeah. I think maybe he's politely declined. As a matter of time, right? It's been like almost 2 years at this point, and he still hasn't. I did do actually like briefly an assessment. So, and I said, for sure, I confirmed. I said, like, look, your foot doesn't move. He's like, "Oh yeah, my ankle's always been stiff. I had horrible sprains." I was like, so, you can't, I can't drag the horse to water. Actually, even they're too big. They're too, um, and it's, yeah, I just don't really see necessarily that the medical establishment, maybe where I am, is like the place where I'm going to really make inroads.
Mm.
So, or perhaps I'm choosing not to take on that battle, or that entrenched perspective about this is like different than what we do. I do kind of think about maybe we do monthly continuing medical educations, and so I think it'd be really interesting for me to like present this one of the times.
Have
Um,
you done that in the past? I'm curious. Did you make presentations to colleagues or the AMA or anything like that?
no, 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 no. Yeah. Well,
What do you mean? No, 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 no. No, are you not a public speaker? I mean, you're doing quite well right now. You could be on stage, no problem.
um, this is, yeah, it's, well, you told me your experience speaking to medical doctors. How well has that gone? So imagine a room full of people that a room full of so
Crickets,
you're
crickets.
I mean, the other thing is like it is no it's no small part the sheer amount of how full your time is to have any space. I mean, we are required to have hours and hours of continuing medical education to maintain our license, let alone, just practice and get our patients seen with what we already know. I mean, it's, I mean, say, I don't, this, as an example, like you're making Thanksgiving dinner all by yourself for like 20 people. And then suddenly, like an hour before, the guests are going to arrive, like, oh, hey, let's make like, special ham instead of the turkey that's in the oven. And you have to suddenly, I mean, it just, I think like the juggling time piece of it adds to, I don't think that people are
All right, Doc,
incapable.
I'm gonna call you on this. This is that those are just excuses. Forget it. Here's what I want to do. You and me, we could put together a presentation. We can co-present. I just presented at the World Conference for the Medical Fitness Association. It was online. It normally out of Baltimore, Maryland, and they were very intrigued. They loved it. They want to hear more. So, what would that be like to actually bring a medical doctor and myself together talking about anatomy and motion and how we need to start to think a little bit differently? And then just also just kind of on a spin-off, I've been invited to speak to the student body at the Palmer Chiropractic College, their West Campus here in San Jose. So there's interest. Granted, it's chiropractic, so they're going to be a lot more understanding and intrigued by it than say Western med. But I'm saying right now we should put something together and at least present at the Medical Fitness Association and just get something going because they're hungering for it. They really are. And maybe not in the clinical setting, but maybe in the hospital settings and start to go with that approach. What would you say to that? Would you be up for that?
Tell me where and when. I'll be there.
All right, all right. Then there we go.
Actually, okay, so this is like clarifying for me. This is what I envision. Okay, so
Yeah.
again, I'm very much early on the learning curve because I'm still seeing like the diabetics and the colds and so I'm having maybe like a couple people per week in the clinic and then outside, right? So that's like it's a slow and what I envision is like cutting back on the hours in my clinical practice so that I can do more of this. Um,
Wow.
but I've already, treated a few runners, and it's gonna. I mean, I'm building a practice, right? A body and a movement practice. So I think as I get more people who word of mouth. So um, I've not been taking care of athletes primarily. I'm actually been taking care of older people, like they just can't function well in their normal life. And they don't have that same kind of like pool of like really dedicated and hungry to like the couple of runners, right? I think that if I can kind of make in with their group and their running groups and such, like I see that that would be the way I start to make influences that I'm known as a person that can help with this. And then maybe um, I've thought about going to the local running store, and telling them that I like to do a presentation or like talk to um, some of your runners and see if they want to come and we could do like a little overview. Anyways, I have thoughts about like, yes, this needs to be disseminated. I mean, I think it should be a core part of medical curriculum. Even if people aren't actually training to do it in the clinic themselves and incorporate it, it's tricky, it's difficult, but to understand it and be able to refer to or to suggest, or I mean, I think physical therapy, honestly, if this was like a really integral part of like how they approach, I mean, we send people to physical therapy all the time, they're like very hand in hand with like MD. And so if I knew that they were getting this, that would
Yes.
be great. So, I
Instead
mean,
of some typical protocol with a mimeograph sheath, right? Yeah.
you know,
Yeah. Well, we could bash physical therapy all day long if you want to.
yeah,
I'm
I
just
mean,
kidding.
the
We
couple
don't.
last year, I had frozen shoulder. It was horrible. It was horrible. was like my idea of I'm a healthy, active person, and I had frozen children, and I did everything. I tried kind of like the right things, and physical therapy was not a good fit for me. And I really, I feel like I really stuck. And then it was funny. It was like talking to um another, just like kind of like messaging with like an AIM friend who said like, well, have you really applied? It's upper limb, right? So I was kind of like not too solid on it, but nonetheless, I really revisited it. I tried, I reapplied it very carefully, very thoughtfully. It made more of a difference than anything than, that altogether, right?
I love it. You had the tools all along, and you sought out the almost like the knee-jerk reaction that most people do, and then you came home to what you knew, and things had a better effect. That's great.
Haven't taken upper limb course yet because COVID came, and so so I was gonna sign up for that course. I was wanting to get on the way. That's my excuse.
No, that's good. Well, we've got the biomechanics closed chain lower body, and very soon the upper body is going to come out, and you'll be able to take that too. Speaking of the online stuff, do you use the educational platform?
So I have okay. So I have so many AIM videos that I need to sit and look through. So I did some of Chris's hour sessions, which were great. It's just a lot. It's a
Mhm.
lot. If I were full-time retired and could just do this, I would love it. But I have to kind of like pick and choose and say like, if I have an hour this week, what am I gonna spend my time trying to like incorporate? So it's hard and frustrating recognizing I have experience deficits, I have knowledge deficits in this, and I want to be more proficient and know it all, but I just I have already existing normal life before that's still needs um maintenance and
Yeah.
attention.
Now, I just put it on in my car when I'm driving from here to here, and with California traffic, that's all. You've got plenty of time to learn a foreign language or to watch some. Well, not watch. I take that back. I'm
Yeah,
not
you can
watching videos.
you
That's
can do
that's
the
not right.
online
I want to
platform
put that
while
out
you're
there.
driving in your
No,
car.
no, no. I'm merely listening. The screen is flipped down, and I'm just listening to the educational content. And I go through hours and hours of that, and it's a great way of just kind of feeding it in while yelling at the slow person in front of me. It's a fantastic way to learn. Uh,
Okay, I never thought about just listening to like the online platform.
yeah. Yeah,
Yeah,
because when you really consider it, a lot of those courses is just Gary or Chris standing up with a piece of paper beside them, and half the time they're just chatting. So it's I don't lose much because I'm not watching it. I'm able to
okay.
get quite a bit of the content. So
Yeah, but
uh,
then I see that part about stand up and try this and da, 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 and then I'll be in the middle of something else and it's me
yeah,
multitasking in it.
good
So
point. That is a good point. I can't do it then. I pull over to the side of the road. No, that doesn't work. Uh, this has been so fun. I have been really, and I am sincere with the Medical Fitness Association. They are accepting applications for presenters for this coming year. So I'm going to email you that information, and between the two of us, we'll come up with a presentation that we can co-present, because I think it would be so powerful to have two of us that are doing it, is one from kind of the field, so to speak, and one who has been entrenched in the medical world. I just marry those two together and present something. I think it would send the message home a lot stronger than just some gym rat that's talking to a whole bunch of nurses and doctors. So if you're sincere about that, I'd love to do that.
so you are talking to nurses and doctors.
Oh yes, yes, nurses and doctors. Yeah, I don't know how many hundreds of people were in the virtual audience for the
Yeah.
MFA's conference, but
Yeah.
I got quite a few reviews and feedback, and they really liked the information. They would like more, so we've got kind of that open door invitation to come on back.
Excellent. Well, we need with the buy-in, we need to get them moving. We need these medical people to experience it. And that is, I mean, aside from the content and the information, I think once they actually experience it in their bodies, that is the buy-in. I mean, it's
Right there.
the method speaks for itself. So
So let's do a little plug for you here. You're in Norman, Oklahoma, which again, the hilliest part of Oklahoma, maybe not. But if people wanted to not necessarily go to the medical clinic, because that's just staff, faculty, and whatnot, But if they wanted to come and experience your work, say in that yoga studio you spoke of, how would they get a hold of you?
Okay, so movingwellness.org is my website. And there's a Facebook page as well too, but probably the website is easiest, movingwellness.org.
All right,
And you
fantastic.
can, yeah, message me from that.
Beautiful. I'll put that information in the details down below so anybody can go and click on that and get right to you. I I don't know when we're going to cross paths physically, but this has been really nice to reconnect. And it's funny you mentioned like going. Where do I go for these courses? I could go to Ireland or London. And was Santa Cruz not that okay for you? Granted, it was a little rainy when you came, but it wasn't that bad, was it?
Oh no, Santa Cruz was lovely, lovely. I I guess that the way the methods would, I thought like, oh, there'd be a a Chicago location. I mean, I'm used to medical conferences. I thought like Atlanta, Dallas, I mean, I love the Bay Area. I was very excited to get a chance to go to Santa Cruz, and I got to connect with some friends while I was there. So it was really, I just didn't realize it was, oh, I just missed the deadline. I'm gonna have to wait till next year because there's only one time per year in the US, and the only location they picked in the US, that's what I
Right.
meant.
No, I get you. I get you.
No, it was a
Well, it
love.
used to be San Francisco, and then things kind of changed. I don't know how it got to Santa Cruz. But anyway, I love it. I thank you so much for your time. And I next time I find myself at the university, I promise there's a lunch or a dinner in it with you for
Excellent.
sure.
I look forward to it.
If you'd like to find out more information about the flow motion model, anatomy and motion courses, or Gary Ward himself, pick up a copy of his book, What the Foot, at findingcenter.co.uk. And while you're at it, pick up a copy of my book, Return to Center, where I take the flow motion model and apply it to strength training and conditioning. You can get a copy of that at rockysnyder.com. Thanks for listening.